Okay, I do see that it's 7:01. So, in the interest of time, let's get started. Good evening, everyone, and welcome to the final installment of the Know to Prevent monthly virtual speaker series for the 2020-2021 season. For those of you joining us for the first time, we are Know to Prevent, a collaboration of youth-focused coalitions and agencies in Westchester, working together to provide parents and caregivers with the essential tools to increase resiliency and to reduce risky behaviors in our young people. For more information on the collaborative, as well as recordings of our previous presentations, please visit knowtoprevent.org. Before we get started, a couple of housekeeping items. Tonight's presentation is being recorded, and all participants will receive a link to the recording tomorrow, along with a link to the tip jar. The tip jar will highlight key takeaways, information, and prompts from tonight's speakers for you to have as a reference. There will also be a live Q&A session at the end of the presentation, and we encourage you to type in any questions you may have during the presentation into the Q&A box. At this time, I'd like to introduce one of our lead coalition sponsors, Nancy Pasquale, the coalition coordinator for the RIE ACT Coalition. Nancy?
Thank you, Lisa. RIE ACT is a local coalition in Rye, New York, funded through the DFC support program. And as Lisa mentioned, we're one of the sponsor coalitions in the Know to Prevent collaborative. We've been thrilled to be able to be part of bringing this relevant and helpful information, even in light of the pandemic, to your living rooms and bedrooms and kitchens. And so glad that so many of you have been here to be with us for all of these. So we're thrilled to be part of this last one tonight. I have the pleasure of introducing three fabulous speakers who are joining us this evening. I'm going to start with Beverly Pierce. Beverly is a licensed clinical social worker who's been employed at Student Assistance Services for the past 25 years. She's the director there of the Mental Health Services and directs the Student Assistance Services Counseling Center, an outpatient mental health clinic serving adolescents and young adults in our communities. She holds 2 master's degrees, psychology from Long Island University, social work from Columbia, and she is a credentialed alcohol and substance abuse counselor, or a KSAC, and a credentialed prevention professional. Lauren Johnson is the prevention coordinator at Purchase College and the chair of the Collegiate Alliance for Student Success and Prevention, KSAP. Lauren also holds a master's level KSAC and has over 12 years of experience in substance misuse prevention, treatment, and recovery, specifically most recently at the college level. And I will finish tonight with the first of our 3 speakers, and that is Ellen Morehouse. Ellen is also a licensed clinical social worker and credentialed alcohol and substance abuse counselor. She is the executive director of Student Assistance Services Corporation, which is a substance abuse, bullying prevention, and mental health treatment agency located here in Tarrytown. And for those of you who are on this evening, I'm sure many of you know Ellen has dedicated many, many years to the health and well-being, particularly in the prevention arena of our young people in Westchester County, and we're grateful to have her here to get us started. So Ellen, we're going to start with you, and thank you.
Thank you, Nancy. I'm so happy to be here, and thank you, Lisa. Tonight, I'm going to spend just a few minutes talking about for what it might be like to be a senior in high school right now. And then I'm going to spend the rest of the time giving some specific strategies that parents can use to try to help their child through their transition. So for parents, the main thing is that this summer, the end of school this year and going into the fall, you're going to be struggling with balancing having your child be independent, but also being responsible. And the end of year high school events can be very stressful for seniors. Just for example, they're busy juggling, finishing everything up, whether it's finals, whether it's an internship, whether it's making plans, but also juggling, maybe an orientation for their summer job or a college orientation, with all of the end of the year celebrations. So there could be a conflict, let's say, between a summer camp counselor orientation and the senior picnic. So that can be very stressful for some seniors. Also, for those of you that have students going to prom, prom can be stressful. The whole idea of who are they going with? What are they going to wear? How will they look? Are they going to dance? How much is it going to cost? And what are they going to do after the prom? And if they go someplace after the prom, what will be the sleeping arrangements? And what will the substance use be like? Now, for some of you, you have what we call silent sons, and asking your son these questions might get a response of, well, I don't know, or it's not a big deal, or whatever. So what I suggest is that you ask a scaling question, and you say, on a scale of 0 to 10, with 10 being feeling totally comfortable dancing at the prom, and 0, you don't want to dance at the prom, how do you feel about dancing at the prom? And have them give you a number. And then if they give you the number of 5, say, what's keeping you from being a 10? Or why are you a 5 instead of a 0? So you can use scaling questions with a boy or a girl, anybody, if they don't give you the kind of response that you're interested in getting. Also, graduation, there's a lot of ambivalence about moving on. Many students are really worried about changes in relationships. While they're excited possibly to go to school, go to college, they might be really scared, like, will people like me? Will I make friends? But also nervous about losing important relationships that they've had for their whole life all through school. Also, there's a lot of anxiety about going away, living at home, living locally. All of those have their own stresses. And last but not least are the financial uncertainties. Many seniors really aren't sure what the financial expectations are going to be, not just tuition and room and board, but they don't want to be a burden to their parent, yet at the same time, they may feel pressure to keep up with the Joneses or the other students. So the goal for parents is really to launch a healthy senior. And to do that, the first and most important step is to take a really objective look to determine who is your senior. Next slide. I'm sorry. Next slide. These are the things we just talked about. And so really looking at your teen, look, we all think that our seniors are wonderful people and talented and attractive, but look at your teen and try to really see objectively who is your teen, but also how do others perceive them? And then what will they need from you to be successful after graduation? Your task is really to help them form an integrated sense of identity of who they are and have a sense of confidence, but also to be able to separate emotionally from you. It's healthy for a teenager to want to get out of the house and live someplace else. Next slide, please. So the tips for parents are really thinking about who is your senior and looking at their temperament. Are you lucky enough to have a senior who's easygoing? The world just doesn't bother them very much? Or are they a little bit prickly? Things bother them easily. Are they high maintenance? Depending on how you answer that question is going to determine what they need from you. So for example, if they rattle easily, if they have a hard time regulating their emotion, use the summer to help them practice mindfulness so they can control their emotions. If you have a senior on the other hand who's really easygoing, you might need to help them learn how to be assertive, to stick up for themselves. Their appearance. Try to really look at them as others do. Just for example, if you have a really attractive senior, that senior may be bombarded when they get to college. Everyone may want to be their friend. Also, their appearance may change. We all know that girls and boys really develop on different schedules, and it's not uncommon for kids to change dramatically while they're in college. Also, if they are very good looking, they may be perceived as being stuck up and intimidate others unless they're overly friendly. So you may have to point that out to your teenager. If they're not as good looking as some of the other people, they may have to rely more on their personality. When they were in high school, they didn't have to do that because basically everyone knew them, and in many cases since kindergarten. So you may have to help your teenager become more outgoing. And last but not least, really determine their abilities and skills. For example, do they know how to start a conversation? Do they know how to end a conversation? Do they know how to refuse, whether it's a date or a meeting for coffee or alcohol or other drug use? If so, what are those skills? Maybe role play with them and practice to see their level of competence. If your senior's been involved in whether it's drama, music, athletic events, other organizations at high school, it's really important to ask them, what role did being in the musical play for you? What role did sports play for you? What role was being in did chorus play for you? And it might be that it really helped them make friends. It might be that it was a way to relax. It might be that it brought them joy. Whatever it was, ask them, what do they intend to fill that need when they get to college? So for example, if your son or daughter played 3 sports in high school and they get to college and they're not going to be on 3 teams, what are they going to do to keep in shape, meet friends, relax, whatever athletics was serving for them? And have them really think about that and make a plan. Also, we need to help them understand that they may not have the same options at college that they had in high school. So for example, someone who was a starter in a sport at high school may not even make the varsity team. At a big university, they might not even make a club team, but almost all colleges have intramurals. So will there be some other way for them to replace what helped them when they were in high school? Also, what are their study and organizational skills like? What did you have a disorganized senior who waited till the last minute? Help them understand why they need to pace themselves. And also, what are their skills regarding financial management? I'm going to talk more specifically in a minute about that. Next slide, please. Okay, so generally your son or daughter is going to be in one of these situations. They're going to be a smaller fish in a big pond. For some students, this is a relief. The spotlight is not on them. Not everyone will know their business and they're happy to be anonymous. But for some kids, it can be really depressing and it can be really frustrating. So if they're going to a big university, you need to help them prepare emotionally for being a smaller fish in a big pond. What if they're a larger fish in a big pond? And that's the exception, but it happens sometimes. If everyone in the town or the high school knew them because they were the star of the play or they were the star of the sport or whatever, they did the solos in the chorus. They had a lot of attention, but if they go to a university where there are large fish in a big pond, they're going to have even more attention. They're going to have attention from faculty, they're going to have attention from alumni, and they're going to have many more students who know them. So you need to help prepare them for that. If they're a smaller fish in a small pond, they may have been shy and quiet in school, and now they are shy and quiet in a small university. But they probably will be more noticed than they were in high school because the pond is smaller. And last but not least is if they're a larger fish in a small pond, it may be uncomfortable for them because they're not used to all of the attention. So you want them to think through all of these different scenarios and which will it be for your son or daughter. Next slide, please. Okay, so teach skills now. You now have between today, June 3rd, and when they leave for college or when they enter college, to teach them the skills they're going to need to navigate successfully. So I mentioned about starting and ending a conversation. Do they know how to do that? I mean, what do they say to introduce themselves to somebody? And if somebody introduces themselves and they don't like that person, how do they end a conversation? And think about how you would do it and get them to practice that also. Communication. Many kids really haven't had the opportunity, especially with COVID, to read nonverbal communication signs. So you want them not to just be texting, but to practice actually talking and making eye contact, nodding if they understand or agree with somebody. Help them understand the difference between being assertive and aggressive. They need to make their needs known, but at the same time, it shouldn't be in a way that upsets other people or is seen as a threat. How are they going to relax, and what are they going to do for fun? These are things that they can practice over the summer. Same thing with stress management, anger management, time management, and money management. So here's some specific examples. Many seniors don't really understand what's involved in being totally responsible for their laundry. So this may sound like a simple thing, but if your senior hasn't done the laundry, I recommend having them do the whole process, everything from purchasing their own detergent, you know, putting their clothes in the washing machine, timing how long it takes, putting them in the dryer, knowing which clothes need to be on regular heat versus low heat, and see how long that whole experience takes. It's not uncommon for teenagers going to college to start to do the laundry in the laundry room at a dorm and not understand how long everything takes, and then have to leave their laundry in the laundry room, and then they come back and all their clothes were stolen. So it sounds like a little thing, but they need to know. Also, how much does it cost to do laundry? So these are examples. Money management also, if you've been purchasing, whether it's deodorant for your son or daughter, or nail polish, or any kind of toiletry, let them do that over the summer. You can give them a budget, you can give them an allowance, but let them do all the things that they're going to have to do at college now, so they can see how much does it cost to purchase deodorant or whatever other toiletries they need. Next slide, please. So how are they going to actually do this? Well, you want to give them the opportunity to practice the skills now. So the idea is that they should have a chance to practice with people they don't know. So whatever they're doing this summer, try to get them into some activity, even if it's for an hour a week with people they don't know. It might be a volunteer activity, or if they're working in a job where they don't know anyone, that's a good example. But have them practice these skills with people who they don't know, people who know them, they feel naturally at ease with, but people they don't know, they're going to be a little bit tense. They're not sure what to do. So let them practice this summer. And also let them try to be a different person than they usually are, just so they can see what that feels like. So if they're normally a shy person and wouldn't think of going up to somebody to introduce themselves, ask them to practice what that feels like. Similarly, if they're, really chatty and, really outgoing, have them see what it's like to wait and be approached by somebody else. It's really used this summer almost as a laboratory for them to practice. Next slide, please. Okay, a few words just about the prom. With the prom, it's really important to set limits for them to keep them safe. So a very specific thing is to understand what is the plan, and the limit should be go with the plan that you feel is comfortable. So a specific example might be, if they're going to be staying out all night, you might say, you need to check in with me by text every 4 hours. And it could just be a text, I'm alive, I'm okay, whatever. And if I don't hear from you, then I'm going to be concerned. And then I'm going to, and then say what you would do. Prepare for the risks. If they're going away after the prom, know the exact address of where they're going and the exact phone number. Many people don't really know, like if they're going to the Jersey Shore, well, what town is it? What street? If someone says they're going to the city, where? And make sure they have the number for the fire, and you have the number for the fire department, the police department, ambulance. Yes, they can try to call 911, but you all know things go a lot quicker if they know their address and they know what community they're in. Also discuss alternatives. What can they do at the prom if they feel uncomfortable or after? So if they're going with a date who's just a friend, and the sleeping arrangement is they share a bedroom with that person and maybe 2 other couples, what happens if something goes on in that bedroom that they feel uncomfortable with? How can they get out of that situation? Who can they call? I always recommend that you have an emergency code for them, that they can text you or call you and say something such as, Mom, Dad, I'm really sorry. I totally forgot to do whatever it was, pick up that prescription for, my sister, or pick up that prescription for you. Please make sure you go to CVS tomorrow. I'm really sorry. And that means I'm in danger. And maybe you need to text back or yell at them if it's a voice call and say, look, that's so irresponsible. You know, I want you to come home right now. I've had it with you. And that's just an excuse for them to have to leave. Next slide, please. When they get to college, it's really important for you to know that substance use increases between the end of senior year through the first year and after graduation, and that the first 6 weeks of college, students are more vulnerable to heavy drinking and alcohol-related consequences because of the expectations and social pressures. Even though the movie Animal House was made for many of us, you know, when we were children, many high school seniors still think college and a college party is like the movie Animal House. And you need to help them understand what they can do instead of heavy drinking and why heavy drinking isn't okay. Next slide, please. So it's important to have the talk around alcohol and drug use. And the first step is to clarify your own values. How do you feel about your son or daughter drinking or using marijuana at college? And if you really believe that there should be a no use message, please make that clear to them. Say, I really don't want you to drink. I really don't want you to use marijuana. I don't want you to use other drugs because I'm really concerned about your health and safety. And let them know the facts. Let them know that college students are much more likely to be the victim of a crime or the perpetrator of a crime if they are under the influence of alcohol or one of the other drugs. But also let them know that this is really a time for you to develop relationships and to form a personality. And if you do all of that while you're under the influence of alcohol or another drug, you're not going to have the confidence that you know how to do that. Specifically, if you kiss somebody and you're always high, how are you going to know if you're a good kisser? I know that sounds like a ridiculous example, but be really specific about why you don't want them to use. Also, just like the emergency escape from a post-prom situation, have them make a plan in case they're in a situation where they feel unsafe, whether it's at a fraternity party, in the dorm, walking across a college campus, or anything. And certainly seek help if problems persist. Next slide, please. Okay, so I'll be happy to answer your questions after, but please use this summer and the last few weeks of college to focus on these issues. I think you'll feel better about them going away knowing that they have some of the skills we discussed. Beverly?
Please share my slide back.
Sorry, just hang on one second.
Okay.
Thank you so much, Ellen. And we are going to move on to Beverly. Yeah.
Thank you. Next slide, please. So good evening. So what I'm going to do is I'm going to talk to you and give you a little bit of data as a way of introduction. And then I'm going to, I am actually covering the mental health piece. So I'm going to give you a piece of introduction with some data. And then I'm going to talk about some of the more common mental health problems. And then I'll move on and just touch on some of the more serious mental illnesses. And I'll move from there to talk about the impact of alcohol and other drugs. And then I'll give some tips for parents. Next slide, please. So here's what's important to know. The National Institute of Mental Health data lets us know that 1 in 5 adults live with a mental illness. That's 20% of all adults. More women than men, 25% of females and 16% of males in the United States live with a mental illness. Now, the highest prevalence of mental illness is in the young adult category, ages 18 to 25, and that's at just over 29%. the first onset of mental illness usually occurs before adulthood. And as a matter of fact, 50% of all lifetime mental illness begins by age 14. And that's actually about high school. 75% of mental illness, lifetime mental illness, begins by age 24. So pretty early, the signs are there. So what's the point? The point is that it's very likely that your child's roommate, a friend, will encounter a mental health problem while they're in college. So it's important to talk to your children to make sure that they know that if they encounter any mental health issues, if they begin to struggle in that area, if they have a friend or a roommate that struggles in that area, that they are not alone, because mental health problems are quite common. We have so much certainly going on over the last year with a lot of advertisements, trying to keep down stigma, things like Talkspace and a lot of other apps that are available to really promote opening up and talking about some of these issues, because we recognize that early identification and accurate diagnosis is really vital to treatment effectiveness. And it really can prevent significant mental health problems from developing. Treatments are available. Treatment is accessible, and treatment is actually quite effective. What we also know is that the current college students, more than any generation before them, have really used college campus health services. And that really says two things. It really says that young people are taking charge of their own health, but it also says that colleges have services in place to help. So that's important to know, certainly as a parent. So as I began to talk to you about some of the more common mental health problems, they are listed in two categories. Generally, all mental health problems or any mental illness, and they are recognized by a level of impairment. So whether the impairment, it could actually be no impairment, mild, moderate, or severe impairment. And then there are also serious mental illnesses. And that's a smaller subset of the mental illnesses. And it's really categorized that way because of the degree of functional impairment. We know that all mental illness can be serious, but the DSM, or the Diagnostic and Statistical Manual, characterizes serious mental illness as those mental illnesses that have a degree of functional impairment that is significant. Next slide, please. Okay, so we are going to start with anxiety disorders. And as you might guess, anxiety disorders are the most common of the mental illnesses. And when we think about onset, it is probably also one of the earliest for onset. So with the median age of onset actually being around 11. And so everyone has experienced anxiety on some level. So anxiety is also quite common, but the degree to which it impairs functioning can really be the concern. So normal anxiety actually can be enhancing. It can be helpful. Normal anxiety can really prompt you to move forward, prompt you to study for that test, prompt you to take care of a task that you've been procrastinating on. It can help you pay attention or to focus on something more intently than you might otherwise. So that certainly is normal anxiety. But if we're talking about an anxiety disorder, that's really more of avoiding situations that trigger or worsen our symptoms. And that really is the difference between enhancing our functioning or impairing our functioning. So when the anxiety gets to the point where it impairs our functioning, that's when it becomes more than just anxiety, but an anxiety disorder. There are both physical and emotional symptoms. The physical symptoms are things like heart palpitations and sweating and muscle tension and shaking. And emotional symptoms are fears and impending doom and worry and irritability. And these are some of the symptoms that we might see. There are certainly effective treatments for anxiety, and those include individual and group psychotherapy. There are also often medications that help. They don't cure, but they certainly relieve symptoms. And when symptoms are relieved, it really allows the individual to function. And then some of the other things that help with anxiety are certainly stress management and meditation. Next slide, please. I'm sorry, before we move on to the next slide, what I did not mention is that there are multiple, when we're looking at anxiety, there are about 7 different categories of anxiety. I mentioned just the top 4 here, and those are the ones around the circle. So certainly phobias and social anxiety, panic disorder, and generalized anxiety disorder. But there are some other areas of anxiety that are less common, so we're not going to go into them. Next slide, please. Okay, and then we have the eating disorders. And again, the eating disorders, these are the 3 most common of the eating disorders: anorexia, bulimia, and binge eating disorder. These also are quite relevant for both high school and college age students. Anorexia, generally, the onset is around high school. Bulimia and binge eating disorder occur a little later in adolescence or young adulthood. Anorexia is characterized by restricting intake, really a disturbance of body image and a fear of gaining weight, generally very underweight. The eating disorders themselves can be very physically damaging and have a lot of medical factors involved with them as well. So it's really important to pay attention when we see some of these signs so that we can get the help that's needed. Bulimia and binge eating disorder are similar. Bulimia has the binge eating, but it also has the compensatory behaviors, and that might be the purging, that could be the over-exercising, that could be, those types of behaviors to compensate for the binge eating. And then the binge eating disorder, of course, has the binging, but also a lot of the distress related to the binging. And so you can see those listed there. Again, it's important as we recognize, certainly once our young people are in college, that they are preparing their own meals, they are or going to the cafeteria and choosing their own meals. It's important to be up on what's happening with them and looking at them and noticing the changes that might be occurring around their eating. Next slide, please. Depression. Now, depression is another one of the more common mental illnesses. It's another one that's pretty common. There are many signs and symptoms, and they are listed here. There's also a spectrum of depression, so I'm not going to go into it, only to say that this is a good group of the signs and symptoms. And if you are concerned about many of them, certainly not just one of them, but if there are a number of these signs present, you might want to have a conversation or look more deeply into the possibility of depression. In the United States, 20 to 25% of adults 18 or older are affected by depression. So it's also certainly pretty common. And the symptoms that are listed here, in order to be diagnosed with depression, you would need to have these symptoms for most of the day, every day, for at least 2 weeks. So just feeling bad for a day or two would not qualify. Next slide, please. Suicide. Certainly suicide is another one of the concerns, and it is the second leading cause of death in the United States for those in the high school and college age range. More so for males than for females. As a matter of fact, about 3.5 times more males have a rate about 3.5 times more than females. When we look at contributing factors, though there are several, loneliness and isolation continue to pop up. And so these are clues, and these are the kinds of things that we want to be thinking about and looking at. This stat jumped out at me that 80 to 90% of college students who died by suicide had not received any services from their college counseling center. So certainly colleges have counseling centers. And as I mentioned before, many adolescents are now using those counseling centers. So it struck me that such a large group had not visited the counseling center. Doesn't mean they had not sought services elsewhere, however. But the other piece of refreshing news is that, if you can call it refreshing, is that even though the rates might be higher than we want, overall, suicide rates for college students are still lower when you compare them with the suicide rates for same age peers who are not in college. So that's important to know as well. Next slide, please. And then when we talk about serious mental illness, again, the serious mental illness, it's characterized as serious mental illness because of the degree of functioning or functional impairment. And so I'm just going to talk about bipolar disorder and schizophrenia quickly. Bipolar disorder is characterized by shifts in mood and energy, very often shifting between depression and mania, really intense emotions, sleep patterns, those kinds of difficulties. And what happens there is often the individual is not recognizing the harmful effects or the harmful undesirable effects that are occurring with these shifts. Friends, family may see this, but the individual may not. With schizophrenia is a serious mental illness. It is incurable, but it is certainly treatable. It certainly causes individuals to experience a lot of what we group as psychotic symptoms, hallucinations, delusions, disordered thinking, diminished emotional responses or expression. Late teens, early 20s is generally when schizophrenia, the onset of schizophrenia. Earlier for males, later for females. Generally for females, it's actually later in the 20s and sometimes even in early 30s. So that's also important data to recognize. And then next slide, please. And then when we think about the impact of alcohol and other drug use, we know that substance abuse and mental health problems are very closely linked. Abusing substances can increase the underlying risk of psychiatric symptoms. Mental health problems and substance use problems each have their own unique symptoms that impair functioning in school, functioning at work, relationships. And to complicate things further, co-occurring disorders affect one another. So when one is untreated, it impacts the other. So when substance use increases, mental health problems get worse as well. Sometimes people will abuse alcohol and other drugs in order to maybe attempt to mitigate symptoms of a mental health disorder, to cope with a difficult emotion or to change their mood. But unfortunately, self-medicating does not work. And what tends to happen, certainly in the long run, is that it makes things worse. And next slide, please. And so for some tips for parents, it's very important to notice the signs that your child might be struggling. So stepping back and really paying attention. Sometimes we may see a sign, it may be a subtle sign, and we may want to look past it or think that it will go away. But what we know from the data is that the earlier that we intervene, the more likely we are to have success in effective treatment and working with those issues. So notice the signs, pay attention. Keep the lines of communication open. Your child is much more likely to share problems with you if there's no fear of judgment. If they know that they can talk to you without being judged, they're more likely to talk to you. There's a reason that we have 2 ears and 1 mouth, so that we can listen more and talk less. And so that's important for us to do that. And then I want to impress upon you to prioritize getting help. Not getting help does not make the problem go away. If the problem arises, getting help for your child over fear of what it will do to their academics or social concerns, getting the help is really key. So be aware also that there are federal confidentiality regulations that limit what treatment providers can share. So in getting help, you want to recognize that, get releases in advance where you can, have a plan in place before your child, before things become too stressful, and then act on that plan. Familiarize yourself with the campus health centers, familiarize yourself with the services that are in the community around the college, find out what's available for services, find out about insurance and sliding scale, find out if there are wait lists, if there's telehealth versus in person. These things sometimes take time. So finding out before you actually need the service is helpful in putting those things in place. And I have, I think, 1 summary slide. That's the next slide. That really wraps it up. We know that mental health problems are common and the signs can be quite subtle. So it's important to pay attention, recognize the signs early, and then don't delay in getting help. Thank you.
Thank you so much, Beverly. And I think we have our last speaker on deck, Lauren.
Okay, give me 1 second here. All right. So once again, my name is Lauren Johnson. I'm the prevention coordinator over at Purchase College. And so in my work over there, I work to reduce the negative outcomes of alcohol, tobacco, and other drug use. So I sat on my first post-COVID flight the other day, and as I was sitting there listening to the pre-flight announcements, I started thinking about prevention. And now I grew up in Phoenix, so I fly back and forth from Phoenix to New York quite a bit. But when I get on these flights, I don't think that anything bad is going to happen. I wouldn't get on the flight if I thought something bad was going to happen. But you better bet that I know exactly what to do if anything goes wrong. I could probably say the announcements just as well as the flight attendants up there. But the truth is that, you know, I only have a 1 in 11 million chance of experiencing a plane crash, but I'm still super prepared because I want to reduce my risk at any cost. But when we look at our college students, 30 to 38% of our college students meet the criteria for a substance use disorder, but yet we are very unprepared on how to support our college students with those substance use disorders. Now, in my role at Purchase College, I see parents in really 2 different phases. I see parents during orientation in the summer and the family fall weekend. And a lot of times when I'm meeting with these parents, I get a lot of the not my student message. So I'll try and talk to them about substance misuse, and they'll tell me, oh, my student would never misuse substances. My student is a vocal major. We don't want to hurt their vocal cords. You know, I've heard a lot of different things from our parents about that. They don't really want to talk about the preparation for what might happen because they're stuck on this rhetoric of, oh, not my student, this would never happen. And I really want to take this opportunity to talk about stigma and the stigma that exists specifically with substance misuse with our students. And with 12 years experience, and I think that, you know, Ellen and Beverly would back me up on this, that substance misuse can really happen to anyone. And it's not just those students or those parents. It really can happen to anyone. So let's work together tonight to kind of make a pledge to overcome this stigma so that we can overcome this obstacle that exists for parents and students and families accessing the help that they need, because it really can happen to anybody. So what can you do to help support your students? What resources exist? What questions do you need to ask? And how can you be proactive in supporting your students in their health and really encouraging them to be proactive in their well-being? So we're talking in generalities here because many of your students are going to different organizations and different institutions. So these are really just examples. But it's important to look at what exists on your college campus and to be prepared so that you know what exists and what resources your student has before you end up in a situation where you're panicked. So the first resource here is the Health Services Center. I also wanted to say, a lot of these are going to be presented in your student orientation or in the parent orientations over the summer. And so it's really important to absorb as much as you can during that, but so much information will be thrown at you during these student and parent orientations that you might want to double back and see what was shared with you, but also understand that the orientation leaders for these colleges, they have so much information that they are asked to present to you as well, that they need to whittle down what is actually presented to you. And oftentimes we find that substance misuse prevention and substance use and mental health supports, those are left out of orientation because they're maybe not that warm and fuzzy feeling that parents want to have during orientation. So you may need to proactively ask some of these questions of your orientation leaders or of the supports that are offered to your students during that summer onboarding time. So some of the examples of the resources that exist within the college student support services, the first is the Health Services Center. So this is somewhere where a student may receive physical health services. So this may or may not exist at your college, your student's institution, but this is a place where a student might go if they're not feeling well, if they're feeling cold symptoms, or if they're having a stomach ache, something like that. And this is important to note because you may be paying a student health fee. And so this may be something that you're already paying for and something that you want to take advantage of so that you're proactively helping your student take care of their health rather than kind of sitting sick and not accessing help. The Counseling and Mental Health Center. So Beverly talked about this as one of the resources that are on campus, and many campuses have this available. But it's important to know what, like Beverly had said, is there a waiting list? What services are offered? Is it telehealth or is it in person? Are there groups that exist? Is there a psychiatrist on campus that might be able to help support any medications that need to be prescribed? So again, these are very important things to know so that you are prepared rather than dealing with something on the back end. Is there a wellness center or a health promotion center where your student might be able to learn a lot of those great things that Ellen talked about in that first slide deck? Things like mindfulness and meditation and health promotion and different breathing techniques. So these are programs that a lot of colleges put on to help support the student in their proactive health. Is there a substance use or recovery support center on campus? I have been a part of the collegiate recovery program movement within the United States. And this is a growing field that is available at more and more colleges, but oftentimes they're very undermarketed. So if your student is in recovery from substance misuse or from a mental health diagnosis, there might be something available on your college campus, but unfortunately you may have to seek it out or help your student seek that out. So again, something great to do proactively rather than after the student is experiencing some problems. The Campus Advocacy Services is a service that's available for students who experience sexual violence. So again, good to know. Disability resources, another really great resource to be aware of and make sure that you have that contact information. Academic advising is a huge one. We have a lot of students who are in crisis who have been struggling academically for a while, and they haven't contacted their academic advisor, or they don't even know who their academic advisor is. And that is a great resource for your student to make sure that they're contacting them at the first sign of any problem so that we can help stop that problem before it gets any worse. And I'm a little biased here because I was a resident assistant in my undergrad, but resident assistants are a huge resource for any students who are living on campus. These students are often trained in a lot of support measures. And so it's really great that your student knows who your resident advisor is and making sure that they create connection with them so that if they are having trouble, that they can connect with them. They're a student who is a peer, so people who are going through the same things as they are on a certain level. So it's really great. They may have answers to questions that you just don't know about, or that faculty or professional staff on campus may not have as great of an insight as they do. So I think that's a really great resource. The next big item to be aware of is the student code of conduct. So again, every institution is different, and this is going to look different at different colleges, but most institutions will have a student code of conduct. And this is a document that talks about what is expected of your student, specifically about substance misuse. And if somebody is caught violating one of these code of conducts, what the sanctions look like. And so, we were joking around before the call, Ellen and Beverly and I, about, who's footing the bill, but especially if you're footing the bill for your students' college education, you want to know what the sanction is if they do violate one of these code of conducts, because it may be removal of the student from the campus. So you want to make sure that you're aware of that so that you and your students are making educated decisions about the different things that they're doing. So, if a student does violate a code of conduct, something like underage drinking on campus or using cannabis on campus, different sanctions may look like mandated counseling. So they may have to go see a counselor on campus to talk about their substance misuse. They may have an education mandate to learn about substance misuse. And again, it's very important to know what that looks like so you know what to expect if a student does experience that, so that you can help a student navigate that, because that also can be really stressful for a student who is caught and gets a violation and is having to navigate that. So helping support them through that would be really important to know. So this is a big topic for me, sharing medication and keeping your medication safe. So if your student is going to campus with a medication, it is very important to educate them on the importance of keeping that medication safe, especially if that medication is a psychoactive medication or a controlled substance. So while that substance may be safe for your student to take because it's been prescribed by a doctor, it may be a very unsafe medication for somebody else to take. And so we really encourage about giving your student that knowledge. We know a lot of high school parents control medication for their students, especially if they're a controlled substance. And so if you're sending your student to school without having that experience managing their medication themselves and making sure that they're aware of the danger that's behind either misusing that medication or sharing that medication, it can be really dangerous. It's important to educate them on that. There are lock boxes that some institutions provide to lock up medication. You can also buy them yourself on Amazon for as cheap as $25. I recommend the code ones rather than the key lock ones because the keys will get lost. Experience, let me tell you. So there's a really great way for students to keep their medication safe, whether it's a psychoactive medication or a controlled substance. It's always great to keep that medication safe for your student and help them understand their responsibility in that. The next thing that may be present in a student code of conduct is an amnesty policy or a Good Samaritan policy. Now, this is very important to know as a parent or as a student. These policies state that if a student is violating a code of conduct, that they, if they're violating a code of conduct and they run into a troublesome situation, so somebody is passed out or something like that, and the student calls for help for the student who's in trouble, they can be totally exonerated or maybe receive a lesser violation if they call and ask for help. And so that's called the amnesty or Good Samaritan policy. And many institutions have that, but it's good to know if that exists so that you can let your student know, hey, if you ever get into trouble, call for help because this policy exists. You won't get in trouble or you're getting a lot less trouble. So that's a good thing to know. I'll talk very briefly about the new cannabis legislation. We have a lot of parents who are under the impression that, you know, especially with New York State, that recently legalized adult use marijuana, that it's okay for their student to use and that it's no big deal. And I just want to note that if your student is attending a federally funded institution, which most accredited institutions are federally funded, then cannabis is not going to be allowed on that college campus. And that should be noted within the student code of conduct for your student. And you can read through what the violations look like for that. So how can you reduce negative outcomes? So Beverly and Ellen did a really great job on touching on a lot of this, but it's important to empower your student. So do as much as you can to get the student doing things on their own and helping your student access their resources rather than doing it for them. And encourage and build resilience as much as you can. I love the mantra of you can do hard things and encouraging your student to build resilience around that, but also encouraging them, like Beverly said, to understand when that hard thing gets to be too much, when is it a good time to start accessing your resources and asking for help. Avoiding the writing reflex. I'm a parent of 3 small children, so I can tell you that it's in my nature to just go ahead and write things for them. But as much as you can, try and avoid that writing reflex and hold space for them to help them navigate the difficulties as they go through this transition. Communicate and provide connection for your students. So I encourage parents to set up a communication plan with their students. It's going to look different for each dynamic. It may be daily calls, it may be daily texts, it may be once a week where you all have like a longer family conversation, but set those expectations and that intention early on so that things don't get kind of lost in the roll of things, because your student will be extremely busy once they get onto campus, or if they're commuting or telecommuting, whatever they're doing, it will get busy quickly. So it's good to have that intention on the front end. And then foster protective factors. So Ellen talked a lot about these skills in her slides, so we'll go through them quickly. But these are called the dimensions of wellness. And it's really important to look at these dimensions and kind of do an inventory for you and your student on where some needs might exist so that you can proactively address those things. And there are a lot of resources on the campus that can help you address these things if you do have needs in these different areas. So SAMHSA has defined the dimensions of wellness as 8 areas of wellness, and that includes academic, environmental, intellectual, financial, spiritual, physical, emotional, and social. And I can send a link after this that would include that information, but we have included cultural as the 9th dimension there, because that's something that's really important for your student, especially as they're exploring their identity and they go onto campus, to make sure that they are looking at their cultural needs and making sure their cultural needs are getting met in their holistic wellness. Okay, so what resources exist? You have institutional resources and then larger regional resources. And these are just a couple examples. And of course, it'll be different at different institutions, but these are questions that you can ask about what exists and how you can become proactively a part of some of these things. So a lot of institutions will have a parent handbook. And so this may include things on how to support your student with substance misuse. And it may include even more information about what resources exist for substance misuse at that institution. There may be a parent newsletter. I know a lot of newsletters go out monthly or quarterly, some are more frequent, but it's important to get signed up for that. It's usually an email, and so figuring out how you can get on that would be really important. And I've heard a lot of parents say that there are parent social media pages that have been really helpful for them. So you can seek those out on different social media platforms and try and join those so that you can kind of be with other parents who are going through that same transition with their students to kind of learn more about the campus and what the students are experiencing. So again, you can help be a support to your students. And for regional resources, we have just a couple of really great examples here. Know to Prevent is really, really fantastic. But they have all of their presentations up on their website. So I encourage you to go and seek out more of those presentations. Power to the Parent is a really great regional resource that gives you some great examples on how to have some of these difficult conversations with your student. And then Talk to Prevent is through the New York State. And again, it has some really great examples on how to have these difficult conversations. I didn't put this last one on there, JED Foundation, sorry, this my control bar was blocking it, but JED Foundation is another really great resource that is probably the premier resource for mental health support for students in college. And so their website is just chock full of all sorts of resources and information for students, parents, and institutions. So I recommend that. And then the last one is seizetheawkward.org. And we could put that in the chat box or include it after the fact. But that's a really great website on how to have difficult conversations specifically around suicidality. And so I recommend checking that out as well. And I think my last one is my contact slide. So thank you all, and I'm looking forward to some Q&A.
Okay, so sorry for the delay here. Lots of buttons to click. Did you ever notice that about Zoom? Okay, so we are back. Let me just share my slide. Am I sharing? Yes, I am. Okay, so thank you, Ellen, Beverly, and Lauren for the wealth of information. Before we dive into the Q&A, we would appreciate everyone's feedback on tonight's presentation. If you simply open your camera on your phone and point it at the QR code that you see on your screen, a link should pop up on your phone to access the survey. We will put up the survey again at the end of the Q&A session, and you will also receive a link to fill that out in the email that you will all receive tomorrow. So no excuses for not filling it out. And I will say it is extremely valuable to us in terms of evaluating and taking into account feedback for future programming. We are already hard at work thinking about the lineup for next year. So this will be very, very helpful. So without further ado, I will hand it over to Nancy, who will be moderating the Q&A.
Terrific. Thanks, Lisa, so much. And thank you again to Ellen and Beverly and Lauren for those incredibly informative presentations and all covering different aspects. And I'm going to dive right in because we have quite a few questions that have been coming in. And I am going to start with one that is partially answered. So Lauren, you already answered part of this question. How common are substance use disorders among college students? You had mentioned in your presentation about 30 to 38% of college students meet the qualifications for a substance use disorder diagnosis. There was a follow-up question to that of how common is stimulant medication use in college, and I would throw that out to Lauren and or Ellen or Bev if that's a piece of information that you know.
So I can tell you that the research is kind of varied on this, and it'll tell you anywhere from 10 to 20% of college students are misusing or abusing stimulant medication. And the reason it varies so much, in my understanding, is because you have students who are prescribed stimulant medications who take it not as prescribed. And so we have that concern. But we also have students who are sharing it, who maybe don't understand that that is a way to misuse it, that it's just, you know, a prescription medication, so they don't have the appropriate harm perception in it. So the data really varies on that. So anywhere from 10 to 20%. But again, you know, the more that we can educate our students on the importance of keeping your medication safe, we can really reduce that, because we do know from core data across the nation that the majority of our college students who are misusing stimulant substances are getting those stimulant substances from other students who are prescribed it. So the more that we can keep our medication safe, the more we can reduce that risk.
That's excellent. Thank you so much, Lauren. I'm going to follow that up with another question that came in through the Q&A. You know, all three of you talked a lot about sort of having those open communication lines of communication with your young people, with your children, and especially engaging in the difficult ones. But an attendee is asking, what if your child isn't willing to engage in those necessary discussions?
I'll answer that question. What I recommend is taking them for a long car ride, locking the door, and saying, I know you don't want to talk about this, but here are several things I want to tell you before you go to college, and at least get the information out. I think it's really important for them to hear what you have to say and know that they will be listening to you.
That's great. Thank you, Ellen. So another question that we have, and I feel like this might be a Bev question. Beverly, a question about advice for, or you had talked a little bit about power of it, documents like power of attorney, things like that. So this is maybe a Beverly and a Lauren question, right? Like things like power of attorney, things like release forms, because our college students are 18 or older. What kind of recommendations do you have about making sure that you get those forms? Like, what are the forms that people should be aware of, and how do you have the conversation to get those done before your child goes away or early on?
Sure, I'll start. So what I would say is that you want to talk to your child about getting those releases before those stressful situations occur. And sometimes what you can negotiate is getting a partial release. So it doesn't necessarily have to be a full open release. And maybe the release allows the parent to know if the child is keeping appointments, or to talk to the therapist about themes, general themes rather than content. So the child can feel free to talk to their therapist and not have every word repeated back to a parent. So maybe, your daughter's a little more down this week might be something a therapist could repeat to a parent, as opposed to giving the content about why they're down. So a child might agree to something like that. And just finding ways to negotiate that can be quite useful.
I think that's a great point, Beverly. And there's two other things I want to say with that. One is that these releases of information, somebody asked what they're called, release of information, and ROI. They can be revoked at any time. So a student may agree to do it now, but they need to know that they can revoke that. So it's not like they're making this decision and then something bad happens and they have to share all that information. They can revoke it if they want to. So that may make them feel better about it on the front end, giving permission to do that. And then the second piece of information that I think is helpful is it's a growing practice within higher education for parents to be notified when there's any violation of student conduct. So if a student is worried that their parents are going to find out that they got caught drinking underage or they got caught using substances, if the school is catching them and is catching them in this violation, they're likely going to notify the parent anyways, regardless of this release of information. So while the counseling center and the confidential staff on college campuses cannot discuss anything that goes on within a counseling relationship, student conduct absolutely can communicate information about violations of conduct. So that also may help a student feel a little bit better that the college may contact them regardless of having this release of information. And so the release of information is really going to benefit them to help coordination of care and support.
Terrific, thank you. I'm going to follow up with a question. What if I become concerned about my child's mental health or substance use while they're away at school? How do I convince them to get help if they need it? And there's a particular concern here that was mentioned about sons, right? Who may, or historically often, feel less comfortable, or there may be more stigma attached for males than for females in many cases, about the idea of talking and sharing issues with a therapist. And wonder, Beverly, maybe you want to start with that, but certainly Ellen and Lauren, I think you both would probably want to chime in on that. Like some ideas about how to get that conversation started and really encourage, especially for boys.
Sure. And I think Ellen mentioned something about this earlier, when she was speaking about just, having that conversation. I think that, your child, and if you feel as though something may be occurring, remember that there are many different modalities of treatment now, certainly a lot more telehealth. And so boys may be more comfortable with that, and that may be a way to start. Also, just starting to talk about it even now before they go away to school. If you have any concerns at all, there's absolutely nothing wrong with starting that relationship up right now. There are still 6-8 weeks possibly before going off to school. But also, I believe what I was mentioning before, what Ellen mentioned, is letting your child know that you're concerned about them. You're concerned about their health. And when you frame it in that way, I think that can sometimes be helpful. It's not about making their life miserable or ruining their social life or any of those things. It's about their health and safety. You're concerned about that and you want them to get help. It may require your contacting someone, having that connection at the school. I think it was Lauren that mentioned the resident advisor or director. That person can certainly be a resource. It may involve a visit to the school, certainly depending on the situation. Any number of things may be useful, but certainly finding a way to get the help and not avoiding getting the help. That's what's important.
And I'd like to add one other suggestion. Point out to your student other times when they've received help and how helpful it's been. So for example, you might say, remember when you're having a hard time in physics and you went to the teacher for help, or we got a tutor, how much that made a difference for you. Or remember you were really struggling with some aspect of the team you were on and the coach took you aside and had practiced something with you, or how the drama coach really helped you better, or the choral coach helped you. So let them see that sometimes one-on-one help really has made a difference for them and improved their life.
Terrific, thank you. I'm seeing a question in the chat that says, how does a student make the first counseling appointment at college in a way that ensures confidentiality at intake? And should it be a phone call as opposed to going in person?
I think that really depends on the comfort level of the student and what services are offered at the college. They absolutely can check out the webpage to see what is available for the counseling center, but I don't think that there's any difference in my understanding of making an appointment over the phone versus going in person. There may be some COVID restrictions right now at certain institutions about going in person. So.
And that's a great point. I'm going to use that as a transition moment to talk about one of the questions that came in. After a year of online college, what can we do to prepare our children for on-campus life? This person indicated that they have a child who is about to be a sophomore, right? Has spent this year doing online course, but getting ready to be at school, and maybe some suggestions around preparing for that. Maybe Ellen, you want to start us on that one? Again, wanting to foster more independence, but wanting to avoid the battle that is often ensues when trying to do that, right? The clean up your room, but I'm going to have a fight about it every time. Maybe you want to start us, Ellen?
Sure. And the implication is, will your sophomore be trying to make up for lost time? Or are they going to now encounter situations that they've never encountered before, but they're, a year older? So I think the main thing is to be realistic and to talk about what did they miss freshman year that they're looking forward to. So it might be pledging or rushing a fraternity or sorority. It might be having a chance to participate in a school activity, and talk about what is it going to be like coming in as a sophomore. What are the realistic expectations that they should have, and how should they prepare for it? I want to take a minute and just talk about fraternities and sororities. We know from the research that students who join fraternities and sororities have higher rates of alcohol use than students who don't. Also, students who are involved in athletics and students who are involved in some of the other college activities. Believe it or not, there is alcohol-related hazing for bands. People don't normally think of that. So I think it's important to talk to your son or daughter about what you can do instead of downing a bottle of vodka. So something as simple as, I really want to join this organization. I really want to be a part of the band, or I really want to join this sorority, but I just, can't drink. Is there something else you can give me to do to show that I really want to join this organization?
I'm looking at a question here that's in the Q&A that is asking, are mental health and medical services at colleges paid by the parents' insurance? How is confidentiality maintained when we receive the explanation of benefit from insurance companies? So if you're opting out of the school's insurance, I believe that's what, having a college student myself, right? If you're opting to use your own private insurance and you see something that comes through on your insurance with services, how does confidentiality get maintained? And maybe that's Bev or Lauren, maybe a question for one of you.
Well, certainly if they are using a parent's insurance, they will get a bill. So yeah, they'll get a bill. So the parents will know that they have seen someone, but they will not, that's really the limit of what they'll get. They won't receive any information from the provider, as far as the details or what they talked about or why they're there or any of that information, but they will certainly get that explanation of benefits.
I would just like to add, in almost every state in the country, if someone goes to an emergency department for treatment for a sexual assault, the person receiving the service has the option to say, I don't want to access my insurance. And in almost every state, special funds are available for treatment for sexual assault. So you don't have to access your insurance, meaning your parents would never know.
Thank you for adding that additional piece of information. And another sort of, again, very technical question, but sort of a follow-up to one of the replies. Is that ROI, that release of information, is that form acquired through and given to the university the child is attending, or is it a general legal document? And besides power of attorney for health, what other documents might you suggest that parents contemplate acquiring for their child?
The ROI is going to be specific to the counseling center at each institution. I don't know about the power of attorney. Beverly, do you know much about that?
I don't know about the power of attorney, but all treatment providers, whether it's a college or a community, a treatment provider in the community, a private practitioner, they will all have the release of information and they will provide it.
And how might someone access that if they were looking for it? Beverly or Lauren, do you know?
Contact the counseling center and they'll be able to direct. But if your student, proactively, if you want to sign something like that, the student would likely need to be a client of the counseling center to submit a document like that. But if the document can be given to your child or to you, depending. Directly from the counseling center.
And I would just like to add, I think it's very important for parents to have access to their students' academic records. So a student may not be receiving any counseling, but unless a student signs a permission slip, the parent doesn't have access to the academic record. It's important to know, is your student failing?
Especially because that might be a sign that there's something else going on that needs, it's one of those ways that you can sort of be checking in without hovering and checking in. That's a great suggestion. Thanks, Ellen. I'm also seeing a question here, and there are two that are very similar, about if there are any recommended, like either in-person or virtual, like college prep programs over the summer that are specifically for things like social and time management for prospective students. Lauren, you may know about some that might be offered through institutions, for example, or things about like life on campus, independence, time management. Again, those are both similar questions. So
I think I want to note that as concerned as parents and students are about what they've missed out on, student affairs professionals are just as concerned, and they're scrambling to do as much as they can to provide as much as they can for students, because they know and appreciate how much students have missed out on. So I'm hoping that your student's institution will provide a very complete list of social opportunities for your student. I know that Purchase College is doing a lot of that. But in addition, colleges usually have a career development center or a learning center through the library, and they offer a lot of skill building classes like this. And there may be asynchronous content that's available to your student through those different entities. So you can contact the career development center or the like, or if there's a learning center or a library center that might have some of that content that's available to the students asynchronously, or possibly even a formal program over the summer.
And there are books on like preparing your child for college. I just can't think of any of the titles or authors off the top of my head, but maybe we can post them on the website after.
That would be great. Thank you. And does ROI, so again, a follow-up question, forms are the hot topic. Does ROI give access to academic record?
No, and anybody else feel free to speak, because I am not an expert in this topic, but no, the ROI typically does not give access to the academic record. That would have to go through admissions or through the academic affairs office. And it may look different at different colleges, what forms need to be completed.
Terrific. So I feel like, Lisa, there's maybe time for one or two more questions. And I am seeing some information that's going in the chat as well. I just want to make sure I'm covering all of those. There are generic forms at the state level. You can find them on the web as someone is responding, probably a parent with some experience. So thank you for that. And how do you get the form for access to academic records? What is the form called?
So Christine's put in the chat here that FERPA releases are
Yep.
through the registrar. So that might be the best place.
Terrific. And then I want to go to a question that's a little bit about the right now, what's going on right now in summer. And there are a couple of questions that came in previously. Things like, how do I talk to my child about not drinking in college if I know that they've been drinking, while they've been in high school? Like, how can I engage in that conversation? What does that look like? And Ellen, I might ask you to start us off on that one.
Sure, thank you. That's common. I think that a parent can still say to their student, you're going away to college. There are all new challenges, all new situations. You really need to be on top of your game. And I just really worry that if you're using alcohol or any of the other drugs, that your perceptions are going to be off, your judgment is going to be off, and you might make decisions that are bad for you, whether it's sexually, whether it's socially, emotionally, academically, whatever. So now's really the time to think about not using. I know you drank in high school. I know you maybe smoked marijuana in high school, but I want you to give yourself a chance to really experience college and feel that you can handle it. I can't keep you from using, but I want you to understand why I don't want you to use.
Great, thank you, Ellen. It's similar, but maybe a little bit different and I think that this is particularly relevant for those of us in New York right now, and those of us with students going to school in other places where marijuana is legal, and the conversation about marijuana is a hot topic nationally, of course. Encouraging your child or your teen, your young adult, to refrain from using weed. And the question was specifically posed related to as an anxiety, to help resolve anxiety. So I feel like maybe this is an Ellen and a Bev, sort of combo, just that co-occurring disorders, the prevalence of, so if you could share a little bit about that.
Sure. I think that you can be totally honest and say, first of all, if you use marijuana, you have no idea what's really in the marijuana that you're getting, even if it's from a legal dispensary. There's no state that is totally regulating marijuana in terms of the product as they do alcohol. So you have no idea what the mold content is, what the fungus content is, whether there were pesticides in the product that you're purchasing, whether it's been laced, with fentanyl or anything else. That's the first thing. Second is that if you have anxiety, it's so important to learn how to deal with anxiety. And if you use marijuana to deal with it, you're not going to have the skills to do it. And marijuana is a tolerance producing drug, which means the more you use, the less effective it's going to be, which means you're going to need a greater amount to deal with the anxiety. And when you stop using, one of the rebound effects is more anxiety. So it's really like shooting yourself in the foot. It just doesn't make sense. It's so much more important to figure out how to either prevent anxiety and or how to deal with it without using any chemical.
Beverly, thank you, Ellen.
Okay.
Beverly, did you want to add, did you have anything particular that you wanted to add to that? I feel like that was such a.
The only thing I would add is it may be, and I said this in my when I spoke, that certainly it may be an opportunity to be evaluated, because if that anxiety has reached a level that there needs to be some kind of intervention in order to relieve symptoms so that that child can function, then they might need something. But marijuana, as Ellen said, will certainly not do what, in the long run, what they want it to do. It will just produce more anxiety, as she mentioned. So it may make sense to be evaluated, see a psychiatrist, because there may be medications that are needed.
Medications that are prescribed with proper dosage and specifically for your needs. Lauren, did you have some, I see you unmuted. Did you have something you wanted to add to that?
Yeah, I just, I wanted to say that I lost my train of thought when I was listening to you, but I'll let it go.
So I also noticed that there might have been a hand raised. Lisa, did you check in with somebody had a hand raised? Was there a question?
I don't see a question, but one did just pop up in the Q&A.
Let's take a look at that one. Is there a dangerous situation with your child, for example, self-harm? If there's a dangerous situation with your child, for example, self-harm, will confidentiality be breached and parents be involved? So that's sort of a, is there ever a threshold where confidentiality goes out the window in for the sake of safety?
Sure. In any situation where your child is in imminent danger of harming themselves or someone else, that there's no confidentiality. They will absolutely contact you.
Terrific. So Lisa, I am looking at the time and seeing that we literally have about 2 minutes left. So I wonder if you want to take us home.
I do. And what I will do is just share take our survey slide just one more time. It's super quick, I promise, less than a minute. I want to thank all of the panelists for joining us tonight and offering your valuable insight and expertise. And to everyone else out there for taking the time to join us. We hope that you've been with us for more than one session, but if you have not, all of the recordings are available on our website at intothe.org. So please feel free to visit and to keep up to date on what is forthcoming in the new year. We hope to see you all in the fall and have a great night. Thank you, everyone.